Hello, my name is Ramses Ramirez. I'm a third year internal medicine resident at the University of Central Florida, and today I would like to share with you a very interesting but tragic case that we saw at our facility some time ago. The case, as described in the title, is about a patient who suffered a left ventricular wall rupture, which is a severe and catastrophic complication of myocardial infarction. So I'll go right ahead and jump into the case. Um, we here present the case of a 66-year-old gentleman with a prior aortic valve replacement who presented to our emergency department after experiencing 2 episodes of chest pain that had occurred in the 48 hours prior to presentation. On arrival, his electrocardiogram revealed ST segment elevations on the lateral leads, which subsequently led to the activation of the STEMI protocol. As you guys can see here on the expanded view of the EKG, on leads V5 and V6, we have the presence of significant ST elevations, which are consistent with a lateral STEMI. At that time, the cardiologist on call was contacted and he recommended to do a CTA of the chest to rule out aortic dissection given the previous history of the patient, and the patient was subsequently taken for emergent cardiac angiography. While in the cath lab, the CTA results were called in by the radiologist, and he described that there was the presence of lateral free wall rupture with a hemopericardium. Which time the cardiologist decided to limit the study and immediately contacted the cardiothoracic surgery team. As you guys can see here on the transverse view, we have the extravasation of blood with contrast above the myocardial wall. And here on the coronal view, you can also see it too, and we see the presence of the aortic valve that was previously replaced. Shortly after the angiography was done, the patient became hemodynamically unstable and was found to have pulseless electric activity. Resuscitation protocol was promptly started as the patient was then taken to the OR. However, after a prolonged period of CPR and inability to obtain a return to spontaneous circulation, the patient eventually succumbed to his illness. Interestingly, the preliminary heart characterization revealed a total cutoff over the distal lateral wall consistent with left circumflex circulation, and it also showed a mid to distal LAD descending coronary milking-like effect that we can see here on the angiography, where you can see mid to distal LAD milking-like effect, which means intermittent filling pattern of the coronary, and you can also see it in this view. So milking-like defect it's a phenomenon that is typically seen in myocardial bridging and occurs as a result of compression in intramyocardial coronary segments during systole. This leads to this intermittent filling pattern that varies throughout the cardiac cycle. Milking-like effect has also been previously described in association to left ventricular pseudoaneurysms and true aneurysms. However, in 2016, there was a 2-case report published in Canadian Journal of Cardiology, which described 2 patients that had initially presented with ST elevation myocardial infarction that during the initial angiography showed Milken-like effect. Shortly after the procedure, both of these patients deteriorated very rapidly and were found to have left ventricular wall rupture. Unfortunately, none of these patients survived this tragic complication, which was a very similar presentation to what happened to our patient. The authors proposed that milking effect on angiography could be an early clue of an evolving left ventricular free wall rupture. And they speculated that this is likely the result of the left ventricular wall once ruptured while being temporarily sealed by extrinsic compression of the evolving hemopericardium. We believe that given the extremely poor outcome associated with this entity, early recognition is crucial as it can be life-saving. And since the presence of milking-like effect may in fact uh, be an early clue for developing free wall rupture, we concur with the authors that future studies are required to confirm this novel relationship between these two entities. And that's the end to our case report. Below, you guys can find the barcode, which can be scanned with any smartphone, and it will take you to the list of our references as well as my contact information in regards to any questions or any feedback. Thank you for your time.